Okay, our next speaker is, I'm going to blow this. I feel like I'm out of order here. Dr. Antonio Petralia. I'm going to butcher that, I know. He studied 6 years of BA MD program at the University of Missouri School of Medicine, where he led the free student-run Sojourner Health Clinic. He moved to Virginia for an internal medicine residency at Lewis Gale Medical Center before coming to Cleveland for a rheumatology fellowship here at Metro. His interest in rheumatology stems from his passion for restoring function and quality of life in his patients. Today, he's going to present Living Well with Lupus and Diabetes, which seems to be a hot topic because it appears a lot of our fellow Lupians are being diagnosed with diabetes. So welcome. If I could ask you to repeat the questions because it's being recorded so that people can hear it that are virtual. Thank you.
All right. Welcome. Thank you all for coming and for having me. Again, my name is Antonio Petralia. I'm a first-year fellow at Metro, and I'll be presenting Living Well with Lupus and Diabetes. So I'm going to go over a few different things this morning. Talk a little bit about what are lupus and diabetes, just briefly touching on the root causes. Talk about a couple ways that lupus and diabetes interact, as well as ways to control these conditions. I'll spend a great bulk of the time talking about eating healthily and ways diet can impact these conditions, as well as touching on staying active and avoiding triggers. We'll also have a separate presentation later this morning on staying active in lupus. Finally, I'll give you guys a few different resources so you can learn more yourselves, and more than we have time for in just a short talk. So what is lupus? Lupus is a chronic autoimmune condition where instead of attacking infections, the body's autoimmune system attacks its own body. It's likely set off by a combination of your genetics and the environment that you're in. And while it is a long-term condition that's unlikely to go away on its own, there are medicines that we can use to help control it. Lupus can affect almost any part of the body, but it most commonly causes things like fatigue, joint pain, skin rashes, and kidney damage if unchecked. Lupus almost always needs treatment with medicines to help calm down the immune system, since that root cause is the body attacking itself. The most common medicine we use, called hydroxychloroquine, or Plaquenil is the brand name, may actually reduce your risk of diabetes. Unfortunately, lupus still is very common with diabetes. So on the other hand, what is diabetes? At its base, diabetes is a disorder of insulin metabolism. Insulin is the hormone that helps your body use blood sugar. So there's always some amount of sugar floating around in your blood. Insulin helps your body take that up and use it as fuel. In diabetes, either your body does not produce enough insulin, which is called type 1 diabetes, or your body becomes resistant to the insulin and doesn't utilize it well. That's called type 2 diabetes. Without the effects of insulin, blood sugar will continue to rise, and that increases your risk of conditions like heart attack and stroke. The extra sugar in your eyes can cause vision loss. Around your nerves can cause nerve damage and pain. Type 1 diabetes, since the problem is not producing any insulin, always requires insulin shots. Type 2 diabetes, where the problem is not utilizing the insulin effectively, tends to have more treatment options. Some people are able to simply control their diet and exercise, and that alone can increase the body's sensitivity to the insulin and manage the diabetes. Other individuals may need some oral medicines or may need insulin shots, just like a type 1 diabetic. There are several ways that lupus and diabetes interact. So first, people with lupus are more likely to develop diabetes than the general population. In addition, lupus makes it harder to control diabetes. Both lupus alone increases your resistance to insulin, playing into that development of diabetes. But also, I'm sure everyone here has had a lupus flare at some point and has probably been on steroids, which is absolutely needed for the lupus, but will raise your blood sugar. And if you have steroids frequently, can raise your resistance to insulin. Moreover, both lupus and diabetes increase the risk of many other health conditions, like heart attacks. So the things I'd like to talk about in terms of staying healthy are eating well, staying active, avoiding triggers, and then learning more about your conditions. So in terms of diet for lupus, there's no specific lupus diet like we have for diabetes, but a balanced diet with lots of fresh fruits and vegetables and whole grains, as well as moderate amounts of meat, fish, and poultry tend to be a good place to start for lupus. In a second, we'll talk about some other conditions that can influence the particular best diet for you. There's some evidence that foods like garlic, alfalfa, echinacea may enhance the immune system and worsen lupus activity. This isn't true for everyone, and you don't have to avoid these as a blanket statement. But if you notice, whenever you eat lots of garlic or have an alfalfa salad, that your joints start hurting or your lupus tends to flare, it may be reasonable to cut these out of your diet. And I certainly would not recommend supplementing any of these or anything that claims to boost the immune system. At best, a supplement to boost the immune system will do nothing, and at worst, it'll worsen the lupus, since the whole problem is immune overactivity. Everyone, especially individuals with diabetes, should avoid excessive added sugars. And it is normally okay to drink alcohol in moderation, but make sure to talk with your doctor. So in terms of diabetes diet, we have a little bit more information. There's no one-size-fits-all diet, but carbohydrates, and especially simple sugars, should be limited. The American Diabetic Association recommends what they call the diabetes plate method of portioning your food. It's a great method in my opinion because it doesn't require any weighing or counting. They just recommend that whatever plate you're using, fill half of it with non-starchy vegetables, fill half of what's remaining, a quarter of the plate, with your carbohydrates, and the rest, a quarter of the plate, with proteins. And then finish it off with a 0-calorie drink like water or anything that has 0-calorie sweetener, but trying to avoid things like soda with full sugar in it. I'm going to take a couple slides to talk about carbohydrates since doctors talk about carbs a lot, but I notice we generally don't do a great job of explaining exactly what we mean. So there are 3 types of carbohydrates: fiber, starch, and sugar. If you look at a nutrition label, all of these will be under the total carbohydrate section. Fiber is a little bit different than the others in that it's not absorbed by the body and doesn't really count toward your carbohydrates. Even though it's in that number on the example here, 37 grams of total carbohydrates, 4 grams of fiber. So it's really like your body is seeing 33 grams of carbohydrates. Fiber helps you feel full, it aids in digestion, it helps you maintain regular bowel habits, and it does not raise the blood sugar at all because it only stays in the gut and it's never absorbed by the body. It's found in things like beans, fruit and veggies, especially the skin of those, but fruit does have a lot of sugar as well. And whole grains, again, particularly in the husks, not the inner grain after we strip all that off to make things like white bread. Then the other 2 types of carbohydrates that do count toward your diet. Starches are long chains of carbs. They get absorbed slowly and will slowly cause the blood sugar to rise. These are things like potatoes, beans, bread, noodles, rice. Whereas sugars are short single units of carbs. They're sweet, they taste good, and they spike the blood sugar very quickly. They can either be natural, like lactose in milk, fructose in fruit, or they can be added to make something taste sweeter and better, like sugar in a soda or corn syrup used as a sweetener. In general, it's better to prefer starches to simple sugars, and it's better to prefer natural sugars to added ones in diabetes. And you can see on the label here, they both list total sugars below that red box for fiber, as well as how much has been artificially added for taste. In this example, 12 grams of total sugars, and 10 of those were things that we added in. So this label would not be a great label for a diabetic food. There are also lots of other conditions that can influence the best diet for you. So things like kidney problems, high blood pressure, osteoporosis are all very common complications of diabetes and lupus. If serious kidney problems exist, you may need to limit some specific nutrients and minerals like sodium, phosphorus, proteins. And if you have if you have osteoporosis, it's important to get enough calcium and vitamin D. Calcium is generally found in dairy, milk, yogurt, cottage cheese, as well as vitamin D, which our biggest source is supplementation and sunlight. But in lupus, that sunlight part is hard. Omega-3 fatty acids, like those found in fish and nuts, may reduce inflammation and lower risk of heart attacks, strokes. They're also found in supplements, but there's some evidence that getting it through your diet is better than taking a pill for it. When you're planning the fats in your diet, generally liquid fats like olive oil are better than solid fats like butter because they contain more of what's called unsaturated fatty acid, which helps keep the membranes in your body a little bit more pliable and contribute less to things like heart attacks and atherosclerosis, hardening of the arteries. A quick slide on vitamins and supplements. So there's no recommendation for or against a vegan diet for lupus or for diabetes. But for anyone that chooses to follow a vegan diet, it's important to supplement a nutrient called vitamin B12, which is generally only found in animal products. Individuals with lupus and diabetes are at high risk for vitamin D deficiency, doubly so in lupus since we need to avoid the sun. And you may need a supplement for that. Otherwise, there's not much evidence for or against supplements, so there's not anything we routinely recommend to supplement and either cure or treat diabetes or lupus. There are lots of benefits to staying active. Strengthens your heart, lungs, bones, joints, all of which I'm sure have given everyone in this room problems at some point. Helps reduce inflammation, helps maintain a healthy weight and blood sugar levels, improves mood, sleep, stress, fatigue, and it lowers risks of those other conditions that can be consequences of lupus and diabetes, heart attacks, strokes. So it's important to stay as active as possible. The American College of Cardiology, the heart guys, recommend 30 minutes of moderate activity, which causes you to break a sweat 5 days per week. If you don't already incorporate exercise into your life, that is a lot of exercise and time. So what I tell everyone is if you can hit 30 minutes 5 days a week, that is fantastic. But if you only have time on weekends, 2 days is much better than 0 days. If you can only do 10 minutes at a time, 10 minutes is much better than 0 minutes. So any amount of activity you're able to do is great. And then the last bit is trying to avoid triggers that will worsen either of your conditions. So with diabetes, a healthy and consistent diet is key. If your doctor wants you to check blood sugar, it's important to keep up with these measurements since they can influence what treatments you may need to be on. And it's important to know if your blood sugar is especially high or low and what to do if you get a reading up at 300 or down at 50. There are certain medicines like fast-acting insulin and glipizide that will proactively lower your blood sugar and count on you eating after them. it's important to know if you're on these medicines and not to skip a meal after taking a medicine that is going to proactively lower your blood sugar. And on the other side, it's important not to eat lots of simple sugars, like drinking 2 big gulps all at once, that can spike the blood sugar up to those really high numbers. I'm sure we all know, in terms of lupus, sunlight tends to be the enemy. So when you're outside, it's important to cover up, wear sunscreen, wear a hat, wear long sleeves. May not be easy if the weather's 80 outside, but looks like it's finally starting to cool off now. Generally, the UV index, which is the strength of the sun that penetrates your skin and ultimately worsens lupus, is highest between 10 and 4 p.m. A lot of weather apps or the Weather Channel will also tell you what the UV index for the day looks like. So if they say it's going to be 8, 9, 10, 11, that may be a day that you want to particularly avoid going outside. Whereas if they say the UV index is only going to be 5 today, and you've been wanting to go for a walk in the park, that might be a relatively good day to do so. For both lupus and diabetes and almost every other health condition, avoiding smoking or trying to quit is one of the best things you can do to ensure your long-term health. And if you notice that certain foods trigger lupus symptoms, try to keep a log of those and reduce those. For example, some people know that animal products, especially red meats, will trigger lupus, but in other individuals, it doesn't affect it at all. So everyone's a little bit different, and if you notice certain foods trigger it, just avoid those in particular. My last slide here is about mental health. So another thing we as doctors don't do a good job of addressing, but mental health is part of your overall health. Chronic health conditions like lupus and diabetes take a toll on your mood. Depression and anxiety can worsen sleep, pain perception, and control of your medical conditions like lupus and diabetes. So it's important to keep an eye on your health and reach out to your doctor if you feel that these are impacting your ability to do the things that you want to do. And a very last slide here are some resources. First, the Lupus website. The Lupus Foundation has a million excellent resources on there, including a page I really like on using meditation to ease chronic pain, which I could have gone over a little bit more today. But almost any question you have, there's probably a page on there. I use Lupus Foundation's website quite a bit in making this presentation. Johns Hopkins also has a website with a lot of good information, hopkinslupus.org. And on the diabetes side, the American Diabetes Association has diabetes.org to answer a lot of those questions. And the last one on here, since I get a lot of questions about supplements, Memorial Sloan Kettering, which is a big cancer site, has a website and an app called About Herbs. So if your neighbor recommends that you take ashwagandha, for example, again, there's not a lot of great evidence, and from our perspective, we don't recommend for or against any of them, but this can give you a little bit more information on supplements that may be recommended to you. So that is all I have for today. What questions do you all have? In the back?
Hi, my name is Mercedes Nolan, and I have lupus nephritis. My question is, if you have lupus, how would you know if you have diabetes? How would I know if I have diabetes? Like, will it come, or will I get it?
Yeah.
With all the other, things.
Of course. So the question was, the woman asking the question has lupus nephritis, and she wants to know how she would also know if she has diabetes. Most of those diagnoses are made based on a blood test called either the fasting glucose, which is your blood sugar when you haven't eaten for at least 8 hours. And that'll appear on the BMP, the basic metabolic panel, or it can be tested alone, just the sugar. There's also a long-term sugar test called the hemoglobin A1C, that can measure what your sugar's been over about 3 months. If either of those is elevated very high, then we would conclude that you have diabetes.
You don't take anymore, if you don't take that anymore, what is the chance of you getting that? If you don't take it.
The risk in reduction is relatively modest with taking it. So on the other hand, not taking it relative to someone who does take it may increase the risk slightly, but it's not a sure thing. And to repeat the question, that was on, there's a slide asking if you do not take Plaquenil, does that increase your risk for diabetes? You're welcome.
Is there an uptick with diagnosis with diabetes?
I don't have that information, but it seems like we are becoming more aware of it and paying more attention. You only find the diseases you screen for, and I think it would be very important to screen for diabetes in anyone with lupus.
So how will I go about that?
So the question would be, how would you go about getting screened for diabetes? Is that correct? You could either ask, or the question was who to talk to if you want to be screened for diabetes. You could either talk to your primary care doctor or to your rheumatologist, and I'm sure either would be more than happy to screen for diabetes. You're welcome. Adrienne?
Is there any relationship with somebody who has type 1 diabetes as a, typically that's younger when you figure out that they have type 1, right? And the development of lupus, relationship there?
I don't have the data in front of me. The question was there a relationship between type 1 diabetes and lupus? Don't have the data in front of me, but generally autoimmune conditions do predispose you to other autoimmune conditions. I didn't cover this in the presentation, but type 2 diabetes is heavily influenced by genetics and lifestyle, but doesn't necessarily indicate overactivity of the immune system. Type 1 diabetes generally is destruction of those glands by the immune system and is considered an autoimmune disease. So I would suspect individuals with type 1 diabetes are more likely to develop lupus and other autoimmune conditions. All right. Thank you all for your time.